To have a conversation with one of the greatest statesmen we have in this country, Dr. Warren Kizza Besigye. Romeo, if you can hear me, what is the weather like where you are? Romeo? Romeo, if you can hear me, what is the situation like where you are? Do you have doctor with you? Can we have this interview ready?
Good morning once again, Andrew Chamagero, and thank you very much, ladies and gentlemen, for joining us on this edition of Morning at NTV. We are coming to you live from Kasangati at the residence of the full-time presidential candidate, that is Dr. Kizza Besigye, right here. Well, Dr. Kizza Besigye is also a political activist. Yes, and indeed would like to get his 2 cents on how Uganda has fared as far as the COVID-19 pandemic is concerned. Since March of 2020, we've been grappling with this disease. So many issues have taken center stage, issues to do with accountability, how the government officials have been able to handle the COVID-19 cash that has been taking center stage during this pandemic. We shall get his 2 cents on that. How has the pandemic affected people's livelihoods, the schools, and also the economy? We'd like to know what the retired Colonel Dr. Kizza Besigye thinks about all that. We also do know about the shrinking civic space in Uganda. NGOs are under attack by the central government. Why is government so concerned about the machinations of the various non-governmental organizations in this country? As of Friday last week, 54 non-governmental organizations were actually shut down because of various reasons to do with forgery of certificates. They did not have any permits. Some had permits that were already expired. So the government was like, no, we cannot have these NGOs operating in this country. But then other opposition activists and stakeholders believe that there is something that government is trying to stop from happening. He doesn't want these NGOs from looking into the many operations government has expedited, especially during this COVID-19 pandemic. We do know that the National Election Watch Uganda was also shut down. That was in September of last year, close to the election. Yes, we saw this NGO actually being shut down, so they couldn't operate in that regard. And many of these individuals were calling for foul play. So we'd like to get the 2 cents of the retired Colonel Dr. Kizza Besigye on all this that has taken center stage within our country. Very good morning, Doctor. Thank you for joining us on Morning at NTV.
A very good morning, sir, and welcome to our village once again.
Indeed. It's not the first time we are here. We actually do make these visits because you are one of the elders of this country, and we always do need your recommendations.
Thank you very much, and a very good morning to all the NTV audience, wherever you are viewing from.
All right, let's talk about COVID-19. Largely, we did register our very first case. That was on March 21st, 2020. And we did register our first death in that regard. That was July 22nd, 2020. But even before we had registered our first death owed to COVID-19, 12 people died as a result of heavy-handedness of the security forces within this country. So the security forces had killed more people than COVID-19 in that regard. So tell us, how has the government fared or performed as far as this COVID-19 pandemic is concerned?
Well, thank you very much. I think that that question, is indeed a question that every Ugandan out there will be able to answer easily.
Indeed.
And you see, once you are asking for how you have fared, you cannot measure how you have fared unless you set out a course against which you measure your performance.
The set targets.
And yes, and that is one of the things that has been very frustrating for the country, that there was, and there still is, no clear plan of saying this is where we are, this is where we are going to be in the next 3 months, in the next 6 months, on this, on this, on this, on the basis of which then you can, first of all, see whether that plan is the best, or you can comment on it and say, no, I think this is not the best priority. We would rather put emphasis on this, so that the country is involved in knowing what is being done, what ought to be done, and measuring how we are performing along those paths.
Indeed.
That has not been the case. And this is what has resulted in the kind of situation in which we are. I pointed out a long time ago that Uganda lost the fight regarding transmission. And this is something that, you know, up to now, there is an attempt by government to cover up the loss of the fight on controlling transmission. That was lost very early on. By August, end of August last year,
Yes.
that is 1 year now, we had reached stage 4 of the transmission. Stage 4 is the last stage where you have lost control, the stage that is called wide-scale community transmission.
So the cases were underreported.
It's not about cases, it's about controlling transmission. Of course, the cases are reported on the basis of tests. If you are not testing, or if you are not testing in the right way, you will not know how many cases. And this is why I have been saying that it is ridiculous to discuss the pandemic in Uganda on the basis of the figures that we have. So many positives, so many deaths, so many, I don't know, this and that, because they really don't have any reflection on what is the reality. And so, without a plan to manage transmission, we lost it. We lost the fight to control the transmission.
Yes.
And that's why we lost this whole idea of tracing contacts, because once you lose the fight on transmission and you reach stage 4, then it no longer makes sense to trace the contacts and try to limit how those contacts are mingling with the rest. So we lost the fight on transmission. But even more important than that, I think the biggest losses was, one, the loss of confidence of the public in those who manage
The funds.
the fight, those who manage the response
Right.
to the pandemic. And again, you know, the loss of that faith and confidence in the management of the pandemic was as a result of not having a clear plan, was as a result of not paying attention to the conditions of people, locking down people. You have not planned on how they survive, yet they see you taking huge amounts of money.
5.8 trillion Uganda.
And yes, and disappearing.
From the World Bank, Standard
Yes,
Bank,
yes, yes.
IMF, European Union.
Yes, and this money, you know, disappeared. We were making noise. That money was taken. So people have no food. You have locked them down. They have no food. They have no transport for patients to reach hospitals. Many people are on routine medications. Those who are cancer patients, those who are HIV, those who are diabetics, those who are, you know, they need medication routinely. You have shut down all transport. You have no emergency services to deliver support for them. They are, you know, expectant mothers who need to come to hospital. There is no mechanism for transporting them to get health care. So once you create such a situation, you are stealing money, tons and tons of money, as people are dying of hunger, of lack of health care. They lose confidence in what you are doing. And that was the biggest, one of the greatest loss early on. Loss of the capital, social capital that is needed in the management of a pandemic.
Yes.
Now, so, you know, when you are talking about accountability, up to now, you know, it's scandalous. What has happened in this country, I think, is the biggest scandal possibly that we have experienced. Even when there were other scandals of Chogam, of what, I don't think the extent of looting, you know, of plunder of public resources reached what has happened during COVID, and at a time when the country is in most need. So, you know, now the attention has quickly shifted to immunization. But what is immunization? Immunization or vaccination is the boosting of people's immunity.
Right.
That's what it is all about. Immunization cannot replace your inbuilt ability to defend your body against infection. It boosts it. So what the country should have been focusing on to start with is that people's ability to fight against infection is there so that you can boost it.
Indeed.
If the ability to fight is already destroyed, even vaccines actually don't work. So, but now the attention has quickly been shifted. We must immunize everybody. This is not
so you're saying even if we vaccinate when the people are not having good nutrition and so forth, it's useless because their immunity is not boosted.
Yes, absolutely. You must.
If people are dying of hunger, vaccinations won't work.
In fact, people whose immunity is compromised, and this again has been seen even in this pandemic everywhere, where the immunity is compromised, the vaccination is ineffective, is least effective in people whose, because that's what you are trying to stimulate. You are trying to stimulate people's immunity. So now, the reason there is now a lot of enthusiasm about vaccination,
yes, doctor,
I believe, is not so much the protection as the business. Because again, as we saw just last week, so many private companies were already parading up to consume 720 billion to buy vaccines at an exorbitant price. So, you know, the extent to which people who are managing this country are callous, as insensitive about...
This is an effort not to save lives, but to profiteer.
It's profiteer. It's absolute profiteering. Now, let me be clear. Vaccines are very important.
Yes.
But we also must understand in what respect they are important. As I have said, first of all, as a general principle,
yes,
they are important to boost our immunity. So, even before vaccines, if we are caring for people, we should be caring for their immunity, with or without vaccines. We are not doing that. If you are starving people, if children are starving, if you are, if you have people that are being thrown out of houses because you locked them up, they didn't work, they have no rent, you are not even caring about the ordinary soaps. Because if you are telling people to wash their hands regularly with soap,
yes,
what plan have you put in place to make sure that they have clean water?
If they don't have money to buy food, how can they afford soap?
Precisely, clean water that they can use liberally without, you know, without economizing on the water, because that's what they need in the pandemic. National water should have erected stand points of water supply, especially in congested places, everywhere, and water should be flowing freely. This is something, this is one of the least things that we could afford. Just pay national water, budget for money to give national water, to open taps, so that everybody can have water. If you are not planning about that, how can you convince me that it's vaccines that are going to be Vaccines are not a one-point, solution.
Because we are even getting information from the US and Israel that you might need a third booster coronavirus.
Of course we will. Of course it will be necessary. Nobody knows.
Indeed.
Nobody knows for how long
This thing is going to be here.
the vaccine protects those who even get the immunity. First of all, not everybody who is vaccinated gets the immunity. But even among those who get immunity, nobody knows for how long.
Can you also tell the viewer that even though you are vaccinated, you can still contract the virus?
Absolutely. No. You see, getting the virus in your body, whether you are vaccinated or not, you will.
Yes.
The question is whether you get disease. Now, first of all, quite a number of people who are vaccinated don't get the immunity. That's why we talk about 75% effectiveness of the vaccine, 70%, 68%. It means that the other percentage, the 20–30% who were vaccinated didn't get the immunity at all.
Indeed.
So they remained as exposed as if they were not vaccinated. Now, if you are vaccinated, therefore, unless you have had a test to check the response, and it can be checked, you can have tests to check how you have responded to the vaccine. Now, if you have not had that kind of test to confirm that the vaccine has generated immunity in your body, you could be among those whose vaccination did not result in immunity, and therefore that you are still as vulnerable as the unvaccinated. That could be the case. But, even when you are fully vaccinated and immune, we don't know for how long, because some vaccines last for a lifetime. You only need to be vaccinated once.
Indeed.
And you will live with it, like the measles or polio or whatever, that you will become covered for life. That's not the case with these coronaviruses from the experience of the other coronaviruses that have been around. Now, therefore, we don't know whether it will last for 6 months, for a year, for 2 years. We don't know. What is already beginning to surface is that because of the variants, because of the changes in the virus,
Delta, Alpha variants,
it appears that we will need boosters quite often. Now, but for the country to be focusing on immunizing everybody is again losing the scheme. You are not attending to the basic first things first. Are people getting good nutrition so that their bodies are healthy
on their own.
and able to so that you have something to boost.
Indeed.
Two, the preventive measures in themselves effective. The soaps. Do people understand why they need to undertake them? Have you done enough? So once you have done that, then turn to the vaccines. The vaccines must be highly prioritized. We have not seen that plan, even as of today, of how the vaccines are prioritized. You see all of a sudden a Hamuchigundu taking away thousands of doses for his workers or whatever, where that falls within the prioritization of the country, no one knows. You see people just in the line with the identity cards. There is no saying that only these ones are going to be vaccinated, and you have even identified those that need to be vaccinated. There is total chaos in the vaccination process. In fact, I am worried that many people will contract COVID at the vaccination centers because they are crowding there. There is no mechanism of sorting. What should happen is that ideally you should have registered, if it is Kasangati that you want to vaccinate, you should have registered the priority people in Kasangati, those who are maybe above 60. You can give them appointments. You'll come on this day, you'll come on this day at this time, so that you don't have crowding, so that you don't have unnecessary people you're not going to vaccinate turning up. And then you can indeed prioritize the first vaccination, the second vaccination. If we had prioritized like that, vaccinated all people above 60, who are the most vulnerable, vaccinated those with chronic serious conditions that impact their immunity.
Right.
The others, even if we don't vaccinate at all, I would not be worried at all. Because this is a condition we are going to live with for all our lives. This is a flu for all intents and purposes, except for those vulnerable ones that may get serious disease and even death. The rest can, if their bodies are well, they will fight off COVID, develop their own immunity, continue with life.
In a bid to help the population boost its immunity and also save their livelihoods, government instituted a plan to actually award 100,000 Uganda shillings to over 500,000 households. Do you think that plan was effective? Do you think it achieved its target of helping people?
Absolutely not. The idea is a good idea, that if you lock down people, you must support their welfare, especially in a situation like ours, where we don't have any social security systems, where people don't have any savings they can resort to when they are not working, when people live hand to mouth. So the idea of supporting them is an imperative. But that's what we have not done. Indeed. Giving 100,000 to a few people is not support, because the support should be calibrated to deal with the needs. You know, we have been asking, so how do these people pay rent? Is this 100,000, does it include rent? Does it include care for the children? Does it include, you know, the basic needs we are talking about, that they will have masks, they will have soap, they will have this? It doesn't. So the thing is, once you have no plan, you are planning to fail. But, you know, let's go back to these vaccines, which I'm very worried about. I support vaccination as a public health preventive measure. Right. But we should not also forget that the vaccines we have today are licensed for emergency purposes, because they have not been studied sufficiently. Their impact in the long run, their impact in different situations, maybe in pregnancies, in what, you know, all these things have not been studied for a long while. That's why they are called emergency licensing. Now, if we are still in emergency licensing, why should we be overzealous to immunize those who are not at a high risk of serious disease from this? Why are we saying that our children should not go back to school because they have not yet been immunized? What if the vaccine had not been discovered? It means schooling would end, or what? In any case, up to today, there is no vaccine even for emergency. recommended for age 0 to 12. There is none. So does it mean that our primary school children will remain at home until a vaccine for that age group is discovered? Is that what it means?
Doctor, aren't you particularly concerned that this government hasn't actually secured any vaccines in that regard? We've largely banked on donations in that regard. Yet we collected a lot of money. 5.3 or 5.8 trillion Uganda shillings was collected, but yet we've largely banked on donations from countries like the United Kingdom, these first world countries that have been donating to the country. Aren't you particularly concerned that
Of course, but that,
to handle 22 million
but you see again,
Ugandans with these
that still begs the question of the plan. What plan did we have to deal with vaccination? Let me tell you, actually, instead of all these 720 billion that they want to spend on immunizing school children, if I was in government,
all right,
I would not spend money immunizing school children. I would put that money in research.
Retired Colonel Dr. Kiza Besige on Morning at NTV, divulging more details when it comes to the government's failure to actually effectively address the COVID-19 pandemic. We do have more details that are going to be divulged right here on the show. Let's take a breather. Return shortly, Dr. Kiza Besige. Good morning once again, and many thanks for staying with us right here on Morning at NTV, the number one breakfast show in the country. My name is Romy Busik. Of course, we are here in Kasangati at the residence of the retired Colonel, Dr. Kiza Besige. We're talking COVID-19. We are talking about the shrinking civic space within Uganda. Many of the civil society organizations and NGOs have found themselves at loggerheads with the government. We'd like to know why. And also, this conversation started with COVID-19. It's about to come to an end. We'd like to hear from the doctor. Well, he did mention that the government failed when it comes to clamping down or curtailing the spread of community transmission cases. So does that mean that we might already be in a fourth or even fifth to the sixth wave? Could there be underreported deaths and cases being registered right here in this country? And what would that mean in the fight against COVID-19? What would the recommendation of the doctor be? Call for a lockdown or another measure in that regard? That's what we are going to be talking about. And then we veer into another conversation about the shrinking civic space within this country. 54 NGOs were shut down on Friday. Very good morning once again, Dr. Kiza Besige. Let's continue and you give us your projections. If the government failed to curtail community transmission cases, it would be right to actually expect and say that the cases have increased. People have died as a result of COVID-19, yet cases have been underreported. In that respect, would you call for another lockdown? What kind of measures would you institute if you were in a position of power to handle this pandemic?
Yeah, so first of all, the loss of control in transmission and the numbers of those who are exhibiting serious disease and needing hospitalization don't have to go hand in hand.
Right.
Because a lot of people that are infected and contract COVID will not need any hospitalization. That's the important thing to understand with this particular pandemic. That the greatest majority of people don't need any hospitalization. They will have mild disease or even no symptoms at all. In fact, about half of the people that get infected get well without knowing that they were infected.
Indeed.
Although they have the capacity to transmit, but they are not aware that they have the disease.
Indeed.
Many others will only have ordinary flu symptoms, which will get better.
Indeed.
So you can have a lot of transmission without corresponding concern in the hospitals. Again, because our society is largely young, and so many of those are not vulnerable to getting severe disease and even death. However, the vulnerable population, which we have been saying must be attended to,
Indeed.
these are the ones that have been dying, and very many have died. And let nobody talk about, that the people have died, only 2,000, I don't know what. Very many people have died.
It would be hard to help
the ones
people
that are
today.
reported on are those who have died while confirmed,
in the health facilities.
yes, to have COVID. But very many people have died and continue to die.
Indeed.
So that's why we must again emphasize that since we lost the control on transmission, let's pay extra attention to those who are vulnerable to getting severe disease. Let's protect those. Once those are protected, the rest we shall continue fighting with the pandemic. Because talking about lockdowns,
Indeed.
when you have no control means, for how long will you lock people down?
Are these lockdowns unavailable, Doctor? Because they are saying we could largely reopen this economy if everyone is vaccinated. So vaccinations are not taking center stage. We are still kept at 1.2 million vaccinations. We are targeting 22 million people.
It will take...
So meaning if people are not vaccinated, they are prone to getting infected. So meaning we are actually waiting for a
It
third
will
wave.
take a long time to vaccinate everybody. Even when vaccinated, we do not know how many of those actually become immune,
Indeed.
especially when our levels of immunity before vaccination are themselves low. Nobody has studied the take of the immunity in the vaccinated populations in Uganda yet. So there are many unknowns. We don't know for how long those vaccines will protect our people. They may protect them for 8 months. Does it mean we shall be giving a booster every 8 months when we can't give them the first jab? Now it's coming to a year since vaccines were available.
Indeed.
So my own sense is that let's protect the vulnerable. Let's protect those whose work make them exposed, the healthcare workers. This is why we should vaccinate.
They are still fighting for a lunch allowance at some point.
Yes. This is why we should vaccinate
Yes.
the teachers and the rest of the people. Let's continue with the soaps. Let's just continue putting on masks, washing our hands, getting infected, defeating the infection with our immunity, and life continues.
I don't know why so many experts have not focused on handling the livelihoods of the teachers. Many have just said, let's vaccinate the teachers, and then they will just come back into the fold. But what if they've also been struggling psychologically?
But this,
Shouldn't we be focusing on the welfare of the teachers right now,
It's
so that
not
when we
just
reopen, they're also in the right state of mind to handle their learners?
No, we are not to focus. You see, again,
The promise from President Museveni did not come through.
again, even the talk about teachers is not focused on building knowledge, on the purpose
Indeed.
for focusing on teachers, building knowledge in the country. Because it's not just having teachers in class. It's that those teachers should have the ability, should be in the form to build knowledge in the pupils.
And we have reports that when we reopen, we might not have enough teachers because they veered into other professions.
Yes, and those who come will not be, even before the pandemic, we have not been building knowledge. There have been schools open, but we have not been building knowledge. That's why you find somebody has finished primary school, they are struggling to write their names even. So we are just going through the motions that education is open and the people, we have 1 million children in school, but we are not building knowledge.
Do you believe they increased?
And that's why even this whole question of employment will remain a total, very serious problem.
Indeed.
Because what is powering out of our education system is not knowledge.
Indeed.
What is powering out of our education system is just half-baked individuals who have no knowledge.
Indeed.
If people have knowledge, they will use that knowledge to produce wealth,
Indeed.
whether they are in government or other employment or whether they are able to employ themselves. So even to deal with unemployment, we must have a different type of education. We must have a different focus on education. Have an education that builds knowledge, which we don't have, which we are not planning to have, even by talking about immunizing
Yes, doctor.
these pupils. So the thing is, we are, as a country, we must have a complete reset that is elicited by this COVID.
Indeed.
Because we shouldn't think that it will be business as usual.
Indeed.
That schools will open and life will go on.
But doctor, do you believe the increase?
That the healthcare system we have.
Do you believe the
continue?
continued closure on our schools will increase the inequality gap we've been seeing? Cases to do with GBV that have also taken center stage, child marriages, teenage pregnancies, and so forth.
Without any doubt, even before COVID, education, which was previously one of the best tools for equalizing opportunities in the country, even before COVID, this is what I said. Some schools offer knowledge, some school systems don't. And we have two systems. The public school system here, there is no knowledge. UPE, USE, no knowledge at all.
Indeed.
Private schools also have categories. There are the private schools for the poor, where there is some little knowledge.
Yes.
Then there are private schools for the very privileged, where the real knowledge is being built. So we have classes of young people, those who are clueless about anything, and these are the majority, in the rural areas, even in the towns, people who have no knowledge, the greatest majority. We have those with some little knowledge coming out of private school system. Then we have those who will be the owners of the country.
But guess what has been happening, Dr. Kiza Besigye? The stakeholders who have been doing the most in helping to alleviate some of these challenges when it comes to education, health, and so forth, have been seeing a clampdown from the government, the non-government organizations. Civil society has been attacked by the government. Yet they've been actually on the ground trying to reach out to the rural child, to the rural girl child, to the vulnerable people who have been grappling the most in this COVID-19 pandemic. And the experts were wondering, if they're doing the most, why is government so concerned about the machinations of the NGOs? On Friday, we did see 54 NGOs being shut down. In June of this very year, we saw 5 NGOs being shut down. Around 2nd of January, President Museveni wrote a letter to Minister of Finance shutting down Democratic Governance Facility. A year before that, in November, we saw National Election Watch Uganda, that was actually working on the monitoring of the election, also shut down. We want to know, why is government so focused on stopping these NGOs from actually operating in this country?
You see, if you understand what government you are talking about,
Indeed,
you will have answers to all of those. Because
yes, doctor.
The government that we have, and I think even this COVID indeed has continued to shine a sharp focus, a sharp torch on what type of government we have. We have a government where all power of the country is concentrated in not just even a few people, but literally in one person.
Yes, doctor.
Now, that's the system of such a government, a governmental system where power is held by one person is what is called an autocracy.
The president says money being channeled within these NGOs or civil society organizations is being used to fund opposition or political parties in the country.
So let's understand the government we are talking about.
All right.
We are talking about a government where all power resides in a person. Because all power in Uganda is controlled by the forces. It was captured by the NRA, the National Resistance Army, captured power in 1986. And if you go back there, you'll see on this 26th day, that's legal notice number 1, on this 26th day of January 1986, the National Resistance Army has captured this power of the state of Uganda and vested the power in the national resistance movement. So power of Ugandans was captured by guns and vested in the NRA.
Retired Colonel Dr. Kiza Besige. Let's first go to one of the stakeholders, the NGOs that were shut down. We have
Yes, that's
online.
Where,
we would like the viewer to also understand what is actually happening on that other side of the country. How are they grappling now that the NGOs have been shut down? Dickens Kamgisha is going to be giving us an account of what they've been going through since Friday Day and so forth. He's talking to Stephen Imbide. Let's get into that conversation and then we'll revert shortly in the next 7 minutes to Dr. Kiza Besige to continue this conversation in the country. Dickens Kamgisha.
Yes, good morning to you, Romeo Busiku. This is Buate. I'm at the headquarters of Africa Institute for Energy Governance, that is AFIEGO. And you are speaking to Dickens Kamgisha. I'm so surprised that I found him in the office because as a law-abiding citizen, I thought he would be abiding by the directive or the letter that came from Mr. Stephen Okedo, the Executive Director of the NGO Bureau that was halting the activities and operations as AFIEGO plus 53 other organizations. I'm so surprised to find you, Mr. Dickens Kamgisha, in office.
Yeah, thank you very much, Stephen, and good morning to all viewers. I don't think there is anyone who should be surprised because as AFIEGO, our role is to ensure that we help Ugandans to follow the laws and ensure that they enjoy their rights as an organization and which is operating as a company, not NGO. We have our articles and memorandum of association incorporated under the Companies Act, and we are following everything that is in that articles and memorandum because those are that's our constitution. We expect that, you know, if anyone is going to direct us, it is going to be the registrar of companies. The registrar of companies is the registrar general. And any other entity can only take action if we have committed a criminal, an offense where police can intervene. But if it is a civil matter where you have not complied with this or that, it is the registrar general who is supposed to take action. And that's why we are here. The day the registrar general will direct us to stop what we are doing, we'll be very, very willing.
But this bureau, the NGO Bureau, monitors your work and you go to it to be registered.
You see, the law is very clear. You monitor what you are given, the powers that you are given to monitor. If you are given powers to monitor NGOs, then you monitor NGOs. If you are not given powers not to monitor companies, there is no way you can monitor companies. And the reason we have the Companies Act and Registration Services Bureau, we have the NGO Bureau, is for a purpose. Because I think the legislature knew there are things that the NGO Bureau cannot do, especially dealing with companies. And there are things that you find the Registration Services Bureau cannot do, dealing with NGOs. And they decided to separate those two legal regimes and those two sectors. So for me, I know very well that the NGO Bureau is completely mistaken to think that actually they can have a mandate to direct companies. They can only direct NGOs.
This is not the first time that NGO Bureau is reaching out to these NGOs, some, of course, issuing suspension of activities, letters, or even halting the activities. What do you think is basically behind the curtains? What is going on between you as NGOs and the NGO Bureau?
Yeah, and of course, that is a very, very important question. Because first and foremost, we've been seeing all these things coming. It is not that we are seeing the NGO Bureau and the government taking action against the NGOs, companies. It is not today. Our staff working in different parts of Uganda, they have been arrested by police. They spend days in police cells. And we ask the police, can you take our staff to court? So that we are able to present evidence, they also present evidence. They just do, they have never taken any of them to court. We've seen many NGO leaders being arrested on accusation that no, they are engaged in terrorism. NGO offices closed that no, they are engaging in terrorism. We've never seen anyone being taken to court. But you see, those are just signs of intimidation, harassment. We've seen many other NGOs being invaded at night. They come and take everything from the offices. You report to police. Up to now, we have never seen any police report about those raids at night to NGOs. How can it happen? Some of our companies have cameras, and we give them cameras, but still the police is not interested. So it is very, very clear. So today, when you see many of the NGOs and companies that the NGO Bureau is trying to stop operations, first and foremost, as I said, they are companies that decided not to register with the NGO Bureau. Once you have not registered with the NGO Bureau has no powers over you. You are incorporated as a company. There is a regulator of companies.
URSB.
Yes. Why is it that the URSB is not taking action against those companies if they are not complying? Why is it that the NGO Bureau is actually the one going against the companies? You cannot compare an entity that has decided to follow its certain law, and for you, you say, you must follow me. It means you have an agenda. So it is very, very clear that no, the intention of these actions of the NGO Bureau are not necessarily that no companies and NGOs have not followed the law.
Dickens, you remember towards the build-up to the 2016 and of course 2021 general elections, yes, we saw these raids you're talking about on NGOs, but government was accusing you of investing and being cooperative to those who are in subversive activities. I just want to understand, now that politics is behind us, what exactly, away from these allegations of intimidation or even acts of arrests, what is happening? Because you see some accounts, some NGOs, their accounts have been frozen,
yes,
but they still continue to exist. What's happening? What is just going on that we don't seem to know?
I think the question is about governance. Because I think our governance, our democracy is actually weakening every passing day. That's why when you see people who are saying things are not going well, they go on the street, they are shot, they are killed. The NGOs that you see that are being accused for engaging in subversive activities, I don't think there is any NGO or company in Uganda that does not want to follow the law. If I'm engaging in things that are wrong, I would want and I would wish the government to take action. And the way they take action is actually to go to court. Because it is court where each party can present evidence. But where some of these institutions, like NGO Bureau, for example, it didn't even notify us NGOs. At least the principles of natural justice require that you call the person or the organization or the company to present their case. For you, you sit there, you take action, but it tells you that actually this person or this entity, its objective is not to.
If this intimidation, what you term as intimidation, the closures of these NGOs, the freezing of accounts, if they continue, why don't you take the Attorney General or even this NGO Bureau or even personalities like Stephen Okedo, why don't you take them to court in person, but also as government?
First and foremost, sometimes it is even very difficult to go to court against someone who you know has no powers over you. Because like now NGO Bureau, under the Companies Act, there is nowhere where this company, where the Companies Act, the law that governs companies says that it governs organizations, that it governs NGOs. So where you see NGO Bureau saying that, you know, you are an NGO, you've not registered with us. But if I have not registered with you, at what stage do you say that you have powers over me? Secondly, if I'm incorporated under the Companies Act, and there is a regulator like the USB that regulates companies, if I'm not complying, why is it that they are not?
In 30 seconds, just want to understand the impact if these suspensions and halting the letters, if they put into effect, what will be the impact on the activities, on the people who have been benefiting from these organizations, but also what's the way forward from you as organizations in 30 seconds?
Yeah, first and foremost, the impact is there is that the NGOs, companies that are doing work with thousands of communities who are being chased away from their land, facing all these pollutions on their waters, they will not get the services that we provide. Secondly, in terms of blackmail, that the image of us NGOs being portrayed as if we are not following the law, when in actual sense our law as companies and as NGOs, it is actually to make sure that everyone, the government and the people, follow the law. Our image is being spoiled. The last thing that, as you said, the way forward, I know very well if they come here and say, stop, the next minute we'll be in court.
Thank you.
And I'm very sure we are going to get injunction against what the NGO Bureau is doing because they don't have the mandate to do it.
Thank you, Dickens Kamugisha, for sharing these insights on the ban or the suspension and the halting of activities, of course, from the NGO Bureau that the letters he sent to the 54 organizations. This is Stephen Mbide and Fefeswe Chibuga. Now taking you back to Romeo Busiku, who is in Kasangati, speaking to Dr. Warren Kiza Besige.
Well, thank you very much, my brother Stephen Mbide. And yes, we are still here in Kasangati at the residence of the retired Colonel, Dr. Kiza Besige, and we are talking about COVID-19. Yes, how has the government actually fared when it comes to the handling of this heinous COVID-19 pandemic, and also the shrinking civic space within the country? You do have so many of the NGOs that have been targeted by the government. Well, according to Dickens Kamugisha, who has just concluded that exhaustive conversation, he actually says the National NGO Bureau actually does not have the mandate to execute what they just did. I still do have the retired Colonel Kiza Besige and would like to get his 2 cents on that. Very good morning once again, Dr. Kiza Besige.
Yeah, very good morning. And
yes.
Just before we closed, I was simply saying that the system of government is a system of government in which power resides in a person. All power of state resides in the presidency. And
so you mean the president can wake up and say, I don't want this organization, I don't like this organization,
that's what happens.
Shut down.
That's exactly what happens. Not only organizations, even individuals, lock up that one, lock up the other one. Whether there is any law that backs that or not, that is what is going to happen.
What we've seen is him coming out again to say, it's not me who ordered this, maybe enforcement or operation to take place, like he absolves himself of any wrongdoing later after.
No, some of the things he can't duck, you see, because don't forget that only 1 week ago, he was addressing the country on human rights. And 6 days later, the human rights organizations in the country are shut down.
Yes.
Anybody who has been following Mr. Museveni will understand that that is exactly him. You know, he says what he has no intention at all of meaning or doing. And but what he remains focused on is what will keep him dominating the country's power and exercise of it. And
so
that,
in a nutshell, the NRM government used the COVID-19 pandemic to consolidate power and clamp down on opposition entities.
Yes, with or without COVID-19, that's what they do. Now, organizations, whether civic organizations, whether political organizations, whether political parties or NGOs, any organized group which brings together people to systematically do anything is viewed with suspicion by somebody who monopolizes power. So that's why churches are closed. Don't think that churches continue to be closed because of COVID. Absolutely not. Because churches bring together people regularly. That in itself is a threat. So if there is an opportunity to lock down, to clamp down on churches, they will...
Any entity that enlightens or opens the eyes of
yes,
the
they will do so.
targeted.
They will do so. Because churches every Sunday, these priests are on the pulpits telling, their congregations what should not be happening in the country. That will not be tolerated. I mean, you can't have justification for closing churches when Kikubo, which is totally disorganized, where people come from all kinds of places and mingle every day and go back. When churches are very organized institutions, they had even under the lockdown now, put the social distancing, what? In other places, even the parishioners make appointments that I am the one who will be coming, they allocated seats and so on. So churches are very organized. But it's that what is dangerous to the regime. That organization is powerful. Anything that builds power.
Because even part of the NGOs that were shut down, we have faith-based organizations.
Yes.
And I was also wondering why.
Anything that builds power will either be taken over and become part, an appendage of the system. So the NGOs which are not touched, they are regime NGOs, whose purpose is to perpetuate, is to extend the domination of the country. Those NGOs are open. They will even be given money by the government. But if you are an independent voice that seeks to empower the population, that raises the voices of the voiceless,
Yes, Doctor.
then you are a threat.
But what about concerns coming in from government that many of these NGOs are working or in bed with these foreign entities to actually subvert the will of this government?
Yes, but what kind of subversion? You see, if I am an NGO, for example, this Afiego.
Yes, Doctor.
Afiego is an NGO for environmental and
This is to do with oil exploration and so forth.
yes, and environmental issues, land justice.
Yes.
That is what Afiego does. Now, how does that subvert
Yes.
even if it is funded by foreigners? How can work on the environment, work on land justice? How can it subvert the government? But you see, land justice is one area where control of power extends. Anybody dominating, controlling power wants to control the resources. So that's why there is this whole land grabbing as a policy.
I see.
Now, so if your NGO work is to fight back against the land grabs, then you are an enemy. So NGOs or anybody else who is organized to speak and demand accountabilities, raise the concerns of citizens, will be treated as an enemy.
So you have NGOs that were geared towards actually monitoring this election that was shut down, National Election Watch Uganda. So does this set a bad precedence for 2026 in that we are shutting down NGOs right now in relation to the election we are going to be having in 2026? Do you think we shall have had a very, very shrinked civic space by then in 2026 based on the actions we are seeing right now? And what is the future of the NGOs, by the way?
Well, you see, even as we were talking, even before they were formally shut down, the kind of constriction of the space within which they can operate has been intense. And let nobody be confused that they have been shut down because they did not follow this or that. Absolutely not.
Their critical work during the election.
They have been shut because of what they do, not because they are not, because of what they do and which they should be doing, their legitimate roles. That's what, just like I have said, the shutting down of the churches is not because the churches are not registered or because they are not providing accountability or something to anybody. No. It is political. It is political control. And so, civil society organizations should have expected this. In fact, I am surprised that civil society organizations, even after what has been going on, would be surprised that they have been shut down.
You have one organization that was bolden out, the Citizens Coalition for Electoral Democracy in Uganda. It was shut down, including Nicholas Opio's Chapter 4. So moving into 2026, these are the organizations that were offering oversight on behalf of Uganda. So if they are largely non-existent, what does that mean to the democracy within Uganda? Moving forward, what does that mean, issues to do with accountability going into 2026? It seems like this is a plan by government to stop any eyes or ears from actually being in the sky when we have this election within 2026. They don't want what happened in 2020 to take center stage again.
I think the bold steps that are being taken now by the regime are better than even masquerading as if the civil society is there and doing some work.
Right.
Because actually, the curtailing of their space and work has been already intense without closing them. So maybe it's as well that they close them, that they do what they need to do. Like, you know, I've been saying that the pandemic has helped us to remove the veneer, to remove the facade, the cover of what we are dealing with, that now the military junta is clear for everybody to see. The curtains have been drawn by all these actions so that we know what we are dealing with. What we are dealing with is a military regime, which is why you should disabuse yourself of this whole notion of thinking about 2026 as an election. There are no elections. There are no elections. They are just motions that are meant to legitimize, to offer some legitimacy, some cover again on the military junta. So I think the country will do well. The NGO actors will do well. The political actors will do well. The church leaders will do well. The labor unions will do well. All civil society in its diverse formations will do well to realize that they are going to remain under attack and to organize, to defend themselves in real terms. Yes. That we all pull together.
This is indeed a mind-boggling situation, Dr. Kiza.
It's
mind-boggling because they are calling these organizations terrorist affiliated. But then how is it a terrorist affiliated organization if you're not arresting the ringleader, the leader of the organization? Instead, what we are seeing, they're banning the NGOs. So the experts are saying, if these are terrorists, don't let them go to a shop to do shopping or to a mall to do shopping. Arrest them.
They may even arrest them. You see, Nicholas was...
So since they are not being arrested,
Nicholas was arrested, actually. Nicholas Opio was arrested. I think, among other things, he was even charged with terrorism. So the thing is not that they may not arrest. They may arrest them. I have been arrested and charged with terrorism. But where is the evidence? So it's not just even the arrest. Arrests can be made on all kinds of trumped-up charges. And just like they are giving the reasons for closing them, these are just, excuses that don't even exist in reality. So they can prefer charges, but we all know that there is no terrorism. I have never been a terrorist. I have been charged with terrorism, with treason, with rape, with all kinds of things.
And that's what these experts are saying, that if these organizations were terrorist affiliated, at least the leaders would be jailed. But if they're not being jailed, it means this was a scapegoat. But then how can these civil society organizations push back against this shrinking civic space?
To organize for struggle. And this is what all these civil society sometimes fail to understand. Just like the political parties. Political parties will remain dysfunctional. Civil society organizations will remain dysfunctional. The churches, the faith-based organizations, churches, mosques, and other faith-based organizations, which have been sometimes manipulated by the regime, must understand that unless you are just willing to do the bidding of the regime, all of them, if all of them became mouthpieces of the regime, they would be functioning to just do that.
Indeed.
So, but as long as all Ugandans, whether civil society, whether political parties, whether students, academia, if we all realize that we are captives and that in order for Uganda to go to the next stage, we need freedom to organize and to discuss and to allocate proper priorities for our resources, then this is the time, I say, we must demand a grand reset. All of us must now come together. It should not be civil society. When political parties have been attacked, some civil society people have been quiet. When we are attacked, some churches have been quiet. They should all understand that we are facing the same danger. Let's all pull together and say enough is enough. We must have a reset now.
Dr. Kiza, basically, thank you very much for having made the time to speak to Morning at NTV. Of course, it's been very, very insightful, the conversation we've been having from actually 7:30 a.m. up to now. But then the show did kick off from 6:30 a.m. up to now. Chamagero is in studio, and I've been here in Kasangati to the whole team that we've been working with. Thank you very much for your input. My name is Romeo Busiko. Let's interact tomorrow, same time. Have yourselves a blessed day.